anything you think that clinicians should know in terms of clinical technique when using ACTIVA? Any technique tips that you have?
Yeah. What I've seen from my courses is that dentists think that if you get a flowable composite, it is hard to get a nice anatomy. And I've proven that even if ACTIVA is flowable, with the tip, we can produce nice anatomies. So it's just a little bit of practice, and you will get nice restorations. Flowables are a big topic nowadays. You can trust all the mechanical properties of this new flowable. So don't be scared. Just do your posterior with ACTIVA, and you will have the same behavior as some of the most common paste composites, like, well, I don't know how to mention, like 3M or whatever. The same behavior we're getting from ACTIVA. But the good thing is that you can reduce up to 50% the time if you go for a flowable than if you go to a paste composite. So nowadays I can do 3 or 4 restorations. In the past, I will do only 1 in the same time frame. So I'm more productive, it's more profit for the clinic, and a better service for the patient. It's a win-win situation again.